because all these questions, how are we will we share the information in the eHealth module, we also have to answer that. Well, I first tell something about the background research about spiritual need, because we said to the management, we can do this, but we first want to do some research, because we are not starting to build such a thing. It's a lot of work if we don't know whether people are going to use it and under what conditions, professionals and patients. We use CHIME as a basis. CHIME is an acronym for connectedness, hope, identity, meaning, and empowerment. These are 5 themes in recovery literature. There has been a large review study about concepts used in recovery-oriented care, and these 5 themes were the most important. I will present a study of Selina, and Guusje will present her own study. She finished her study a year ago, I think. Yes. Yeah. Well, first we want to say that Joke van Nieuw-Amerongen-Mees, who is presenting now at the same time, I think, she has done research in Altrecht and Elios, a Christian mental health care facility. And she had qualitative interviews with 14 spiritual needs as a result, and factor analysis, from factor analysis, 3 groups emerged: conversations about religion and spirituality, a program, and a similar view on life or philosophy of life, not only for religious people, also for secular people. This is an example of unmet spiritual needs at Altrecht. Discussion about the relationship between the illness and religion spirituality. 70% of the respondents said, we don't talk about that. And the expected but unmet spiritual needs of patients result also in lower therapy adherence, was one of her results. So this is very congruent with what Rosmarin said yesterday. So there is a certain gap between what patients find and what they think, if their spiritual needs are met or not. They often say no, or they often say nobody starts to talk about it. And what professionals say, this is in our studies too, in the study of Guusje, not Guusje, of CIS, a lot of professionals said, well, we can pay some more attention to it, but on the whole, we are also satisfied with our way of working. The guideline for spiritual care that is now in the making has there was first a survey. 500 professionals were asked a lot of questions, and a majority also said, we have time enough, we pay attention to spirituality, we need some support from or either training or hospital chaplains or whatsoever, but they didn't feel the problem as strongly as patients do it. So there's a gap in this. Well, this is the CHIME, these are the CHIME teams. Guusje will talk about that later. I only want to mention it because it's in Selina's research too, and we wanted to know, are these themes a valid basis to build an eHealth module on? Because then we are working out those themes. So first, we want to help patients to explore their own questions that they consider important for their treatment. And second goal is to support conversation about those questions between patient and therapist. And Selina's research is the perspective of professionals and Guusje of patients and expert by experience. Her question was, what should an eHealth module about spirituality look like according to ambulatory mental health professionals who already work with eHealth? The professionals here are of all ambulatory teams, not only of people who work with patients with severe mental disorder. And how can a spiritual caregiver support those professionals? At the time she she sent her survey. Altrecht was going to the Google surrounding. It was a transition to do everything digital. So we had many technical problems. And that was a pity. That's why only 27 people answered the survey. But still, we must say they give a really valuable insight in building blocks we can use for the module. The questionnaire consisted of 3 parts. How do therapists already give spiritual care in treatment? Do they discuss it? Do they discuss the different chime teams, for example? What formats do they think are fruitful, and what attitude do they have themselves or think their patients have about such a module? For example, do you think most patients are capable to fill in such a module independently? And do you want to discuss the results with the patient? And important preconditions: in which phase of the treatment would you apply it? Would it be fruitful? Do you feel capable to use it? Well, a few respondents only, but still with a small sample, we found a few things. 21 female, 6 male, experience with e-health, 21, doctors, psychiatrists, psychologists, 15, nurse manager, case manager, others, 12. From the teams with severe mental illness, so these are the community care teams, where 12 participants, and other teams 15. And for their affiliation, we use the self-definition as religious or spiritual because it's often used. It's used every 5 years in a great survey in the Netherlands. And we were very glad that more than half told they were neither religious nor spiritual, because we always hear that the own not affiliation, but attitude towards the topic is important to discuss it with patients. But the majority here was not religious or spiritual. In the whole of the Netherlands, in the general population, that is 47%, a little less. What is the current attention those professionals pay to spiritual care, spiritual questions? Do you discuss questions with your patients? More than half does, often or always. Psychologists and psychiatrists somewhat less than other professionals, and the professionals with the community-oriented professionals do it more than the other professionals. The group neither religious nor spiritual, somewhat less than others. That's not very surprising. Do you discuss the religious background? That is less than a third. So existential is easier to talk about than religious or spiritual for professionals. And how often do you refer to a spiritual counselor? 2/3 never does, or seldom. Most often mentioned reasons for referral were when a patient is in a spiritual crisis, when they have feelings of guilt, shame, and need for forgiveness or atonement, when there's profound doubt about the meaning of his or her life. Those 3 were the most mentioned. And we asked about the chime teams, and that was also interesting because connectedness, hope, and empowerment are discussed very often, but identity and meaning is also spirituality, are less discussed themes in treatment. Which formats do you think are useful? Well, these are more than 70% practical exercises, in-depth material for exploration and basic explanation of a professional. A chat function with a spiritual caregiver was mentioned, but one person was very practical. He or she said, well, patients often do such a module in the evening hours. And is there a spiritual caregiver to talk to them? So perhaps we have to look for another solution. Patient characteristics are also interesting because diagnosis is not very important according to the professionals. And this was also in line with what Rosmarin said yesterday. The competencies of the patients to do such a module. Well, that's only a third set. I agree or strongly agree that they're competent enough. And of course, professionals of patients with serious mental disorders more often disagree. They think that patients need more help. 2/3 said patients can start with a theme they want if you use the CHIME teams. And also majority, 2/3, wants to discuss the results of such an e-health module with their patients. That's really surprising, I find. This, I didn't have time to translate it, but here you can see the question here is, when is the module fruitful? Which moment in treatment? The first block is at the moment of intake. The second block is when treatment starts, after the intake, and the majority said in the course of treatment, more than 80%. And the fourth block is at the end of treatment, and the fifth block is when the patient asks for it. It was only 40% who agreed with that. So most professionals think when treatment starts and we are on the way, that's the time to talk about spiritual questions.
Were there more options possible?
Next to those 5 blocks?
No, it was more than 100%. So that's
oh yeah.
So you could like check or.
Oh yes.
Yeah. Yes. Yeah.
2/3 found that an e-health module on spirituality fits in the views of their own department, and the majority thinks I'm capable of discussing the results. The support I need to do this is training, half a day, 3 highest scores training, half a day flyer with an explanation, and support of the spiritual caregiver in complex situation. So the conclusion is that almost 80% said such a module will be a valuable addition to treatment. Well, here you see the different groups that were more or less enthusiastic about it. Well, conclusion is that it can be a contribution, that CHIME can serve as a theoretical basis because it's already addressed in treatment. It's most fruitful in the course of treatment. A majority find themselves capable, and a module will fit in the views of the department. Patients with severe psychiatric disorders, they need a specific format. You cannot make the same format for everyone, and they need more help. Well, most people agree that a free choice for patients with a team they want to start can be implemented in the module. Diagnosis is not decisive. And the 8 is interesting for us as a group. 2/3 never or seldom refers to a spiritual caregiver, and half of the sample needs support in complex situation from a spiritual caregiver.